Hi, I'm Evan Rivers. I'm a physical medicine and rehabilitation doctor with a subspecialty in pain medicine. I work with the University of New Mexico and the Lovelace UNM Rehabilitation Hospital in the pain clinic here. Today I'm going to be talking to you about the spinal cord stimulator implantation and what you might expect afterwards. If your spinal cord stimulator was successful and you had a really significant improvement in your pain and your tolerance of normal activities, then you might decide to have a spinal cord stimulator implantation. I've put together a little mock-up of what it would look like to have a spinal cord stimulator in place. And what you can see is that there's one of these spinal cord stimulator leads inside the spinal canal, and then it connects down to a generator here. And this is on a skeleton, so we can't see the skin. But this generator is tucked underneath the skin, and these wires are tucked underneath the skin so that you can bathe and shower normally a few days after the operation. That way, the device itself doesn't get in the way of your normal activities, but the stimulation that helped you during the trial has a chance to help you for years later. Now, this wire goes inside the epidural space, and then it connects through a little tunnel down to the generator itself. And the generator is about as big around as when you put your fingers together in that OK sign. It's about this big around. And it generally gets placed somewhere over the upper buttock area or in the flank area here. And we connect it to the wires. I'm gonna just take it off and hold it up close to the camera so you can get an idea for about how big it really is compared to my hand. Now, this is a sample from the Medtronic company. We most commonly use 4 different companies. Medtronic is one. I have a little model device for the Nevro device here, and we commonly use Boston Scientific and Abbott as well. Here's the wire, and it goes inside the epidural space like we talked about before, but we have to anchor it in place so it doesn't move in or move out too much. So we lock it down right around here, close to where the spine is. And I'm going to take it out so you can see what it looks like too. So at the tip here you can see these metal dots. And these metal dots are where the electricity goes to help treat the pain. There's tiny little wires that live inside the wire that connects it to the generator. And those tiny little wires the tiny little wires are what communicate what the generator tells these little metal dots to do. Each of these companies has their own special kind of stimulation that they'll offer you, and they've all been demonstrated to be effective. Now, this technology is one of the most successful treatments that we have for chronic and severe pain that lasts for at least 6 months and sometimes considerably longer. So these devices can help people decrease their pain by at least 50%, about 7 out of 10 times when we implant them. And that means that we're not successful about 3 out of every 10 times. But that means that a lot of people, more than half, and quite a few of the people who just don't have any other options for treatment can expect to get a really substantial improvement in their pain and their quality of life when we use this technology. It's not perfect, but it's a really excellent option for people who have terrible pain and haven't found another way to help get it under control. Now, after you have these things in place inside your body, you do have to take it easy for about 2 months to let everything scar down into place so it doesn't move. You wouldn't want to move too much and see one of these wires lose its position, for example. After your body wraps itself around the device and the wires, the body does a very good job of holding it in position so you can return to normal activities. And most folks don't spend much time thinking about their device anymore. It's just a part of their life and it's not in the way. You do have to, with most of these devices, charge them on a regular basis. And it's a lot like those pads that you use to charge your iPhone, where you just lay it down on top of the device and it'll put the energy inside your smartphone. But with these devices, because it's underneath the skin, you'll just lay one of those pads on the surface and it'll give the energy to the device. There are several of these companies that have a version that does not require charging, but it wears out faster. So these devices that you have to charge on a regular basis, they'll commonly last 8 to 10 years. And the devices that you do not have to charge, they might last 2 years, they might last 4 years, they might last 5, depending on how much you're using the device. These are one of our most commonly used surgical techniques for pain management, and it's been shown over a period of decades now to be effective for folks. If you think this kind of treatment might be something you're interested in talking to a doctor about, please reach out to us at the Lovelace UNM Rehabilitation Hospital Pain Clinic.